Hello everyone, and thank you for coming today to my poster presentation, Burnout, a Review of the Literature. My name is Amy Kiefer, and I am a student in the PhD program in the Department of Nursing at Loyola University Chicago. Burnout is a syndrome that is caused by chronic work-related organizational stress and is characterized as high levels of emotional exhaustion, high levels of depersonalization or cynicism, and low levels of personal accomplishment with high levels of inefficacy. Burnout is a problem worldwide, affecting as many as 66% of nurses. Nurses who score high in burnout measures also report an increase in intention to leave the profession or intention to leave the organization. Nurse burnout increases work-related absences and decreases the general health in nurses, with nurses more likely to report depression, anxiety, lower back pain, chronic pain, high blood pressure readings, and also the use of alcohol and drugs in order to cope. Nurses who score high in burnout measures provide a lower quality of care to patients, with an increase in adverse patient events such as an increase in surgical site infections, an increase in urinary tract infections, an increase in patient falls, an increase in self-reported medication errors, and a self-report of missed care. The purpose of this literature review was to collect, review, and synthesize current literature on burnout within the nursing population. CINAHL and PubMed were searched for articles published within the last 5 years and published in English where nurses were a part of the sample size, including inpatient nursing care only. After records for duplicates were removed, and records were screened for further duplicate removal, full-text articles were assessed for eligibility, and then full-text articles were excluded due to the following pre-stated reasons. A total number of 95 studies were included in the synthesis of the literature. The literature for burnout fell into 3 major categories: what is known about the risk for the individual, what is known about factors at the unit level and that affect the development of burnout, and what is known at the organizational level that affect the development of burnout. A majority of what is known about burnout is studied at the individual level in correlations related to developing burnout and what leads to the risk of burnout occurring, and what interventions have been used to reduce the levels of burnout in the individual. A synthesis of the literature is provided in the table on the slide. We know that individuals from certain demographics, single, male, working less than 3 years, with a neurotic personality type, who use avoidant or ruminating coping behaviors, who lack social support, the perception of social support, who report a higher workload with less control over their job or a higher amount of perceived effort, are much more likely to score high in burnout measures. At the unit level, a majority of the organization has focused on structural factors that make up the unit. Nurses who work permanent night shift, nurses who work greater than 40 hours a week, nurses who work within an intensive care unit, a pediatric intensive care unit, or an emergency department are much more likely to have a higher prevalence of burnout on the unit. We know that if specialty education that is focused on the patient is provided to the nurse, scores of burnout decrease. Certain interpersonal factors, such as the feeling of bullying, incivility, exposure to drama, or exposure to bullying and trauma, and nurse to physician relationships, if they are perceived to not be supportive, will increase the risk of burnout in nurses on the unit. Finally, at the organizational level, public hospitals score higher than private hospitals on burnout scores. Leadership styles like authentic leadership, using organizational support with a higher level of organizational social capital will decrease scores of burnout, and certain magnet hospital qualities we know will decrease the risk of burnout in nurses, such as the use of ladders, the use of residency programs, and authentic leadership in nurse preceptors. Further research should be completed at the unit level in the United States in order to further develop what is known about how interpersonal relationships affect the development of burnout, and if interpersonal relationships are an antecedent that could be used to mitigate the risk of burnout ever developing. References are included on the slide under the bibliography section. Thank you for coming to view my poster today.